Sonia is going to be speaking about the integration of sustainability principles into healthcare curricula. As a medical student, we really didn't have, well, when I was a student at least, well, a little while ago now, we didn't have a lot of attention, I guess, given to sustainability or environmental impacts of healthcare, and that's obviously changing. Sonia is going to speak to us today about the as I said, the integration of healthcare principles into curricula. She's a board director for the Doctors for the Environment Australia and chairs the Medical Education Committee, and she holds a climate, health and sustainability portfolio at the University of Melbourne. Sonia is passionate about driving systems change across the health sector to achieve social and environmental justice while empowering clinicians and communities. So I'm going to hand over to Sonia.
Look, I'd like to thank the forum leads for letting me dial in from the lands of the Wurundjeri people here in Victoria. And as Archana mentioned, I'm Sonia Chanchlani, Board Director and Chair of the Medical Education Committee for Doctors for the Environment Australia and Senior Fellow of Sustainability, Climate and Health at the University of Melbourne. A few years ago, I was actually Director of Postgraduate Medical Education, looking after the junior doctors at the Royal Brisbane Women's Hospital. So I'm familiar with the challenges of delivering education to a large clinical workforce, as well as meeting accreditation standards. And that's why I'm really excited to present to you today our new Doctors for the Environment clinical education resources, curriculum integration progress, and cross-pollinate some early lessons learned as we seek new interprofessional collaborations and work together to transition Australia's healthcare sector to ensure a sustainable, safe, and healthy future for all. Aligned to Grand Rounds education delivery, I'm actually opening with a brief patient case study. In a landmark case in the UK, 2 years ago, the coroner concluded that exposure to air pollution was a causal factor in the death of 9-year-old Ella from exacerbation of her asthma, tying the health impacts of climate change and social and racial inequity across the UK, as Ella lived in an area that was exposed to excessive levels of air pollution. The coroner's report specifically noted that the adverse effects of air pollution on health are not being sufficiently communicated to patients and their carers by medical and nursing professionals, identifying calls for action at the undergraduate, postgraduate, and professional education levels. There was a flurry of activity and responses by all sectors identified in the report, including the Royal College of Physicians, Nursing and Midwifery Council, the College of Pediatrics, GPs, and Health Education England, all confirming to review and update their existing education standards to meet contemporary professional expectations. And I guess for us, it lends itself to reflecting on what our duty of care is as clinical educators, and if something like this could happen here in Australia. Thankfully, we don't need our own coroner's report prompting change here. Our education team at Doctors for the Environment Australia has been advocating for updates of the Australian Medical Council education standards that sit at the highest level of educational governance to incorporate both the health impacts of climate change and the principles of sustainable healthcare successfully into the medical school and teaching hospital curriculum standards that are both due to come into effect next year. We're also excited to be working with the AMC early next year to update specialty college education standards to incorporate this into specialist training curricula. So this will ensure that planetary health forms a core part of every stage of medical education. The medical school standards are actually inclusive of Australia and New Zealand universities, but I'm conscious that these new standards recognizing climate change as an important determinant of health and promoting sustainable pathology and prescribing practices aren't directly mandated for every clinician in this audience. But I just do want to remind you that these are the first clinical education standards released in Australia, forming the precedent and essentially the baseline for all other health professionals. As a clinical educator, a strategy I invite you to adopt would include considering these as a baseline for all interprofessional education across your organization, as similar standards may be mandated for all clinical groups in the near future, and remembering that you also have the power to advocate for change within your professional organization. This concept is further reinforced with the new strategy of the National Sustainability and Health Unit, with a focus on decarbonizing the health sector and strengthening education, leadership, and training of the entire workforce. The soon-to-be-released National Safety and Quality Sustainable Healthcare module further strengthens the requirement to incorporate education on the links between safety, quality, and sustainability for all staff. So I'm sure education and workforce leads across the country are starting to get nervous thinking about finding room in an already full curriculum schedule. How are we going to do this? I want to reassure you that Doctors for the Environment have made the first step in developing evidence-based resources that can be used by any clinical educator to introduce concepts of climate health risk and sustainability into all health professional curricula. We just need to work together on an integration plan for your organization, and I'll run through some case studies of how you can approach this. The Medical Journal of Australia published our planetary health organ system map based on research collated at the University of Melbourne. It's an easy-to-use curriculum tool that maps climate change and health to the organ system teaching structure. This can help health organizations meet some of the new education standards. And please don't be put off by the fact that medical is in the title. It's actually relevant to all clinical teaching. And I'll speak to some of the work that we're doing with our nursing workforce. We recognize that your curriculum schedule is already so full with limited space for extra teaching sessions. So to make this integration easy, we've also adapted slides directly from our curriculum map report to enable those of you delivering education to update your existing education material. It's as easy as an educator downloading the free DEA curriculum map slide pack, finding that one key point slide relevant to your existing organ system PowerPoint presentation, and popping it in. The QR code in the top of the corner of the slide takes you to the source report. And so the next few slides highlight examples of the comprehensive curriculum map content that sits behind the slides, including pathophysiology, and direct links between a climate event like heat waves to a clinical presentation like acute MIs. And now we have some new resources about the principles of sustainable healthcare to help you meet the standards covering prescribing and investigation ordering. Some of this is likely already incorporated into choosing wisely education that your organization might have already adopted. Many of these PowerPoints, webinars, podcasts, fact sheets, grand round support, and other toolkits are freely available on the Doctors for the Environment website. And I encourage all educators to scan the QR code in this slide and download, adapt, share with your colleagues, and reference it to your needs. Although these resources were developed by doctors with a focus on the medical curriculum, they're actually just as valuable for nursing, allied health, and support staff education. Our team at Doctors for the Environment has done a great job promoting them over the past year in our spheres of influence with uptake from medical schools, teaching hospitals, and specialty colleges. And I'm now excited to be expanding outside of the medical space as the Royal Melbourne Hospital has expressed interest in incorporating this into postgraduate nursing education later this year. And the Royal Children's Hospital in Austin are interested in interdisciplinary education approaches. A recent big win that we're very excited about is the University of Melbourne undergraduate nursing education team is currently working towards integrating these resources into the pathophysiology core subject for 2024. We've discussed non-integrated education materials like the development of a separate subject, micro-certificates, workshops, webinars, as well as an opportunity to collaborate with the Australian Nursing and Midwifery Federation. So keep an eye on this space. Similarly, medical education leads have reached out to us from a number of sites across Victoria and New South Wales to pilot and evaluate their approach to curriculum integration. So this includes a variation of options that suit them, including orientation presentations, grand rounds, integration into weekly in-service or education sessions, and some are even evaluating this with a pre- and post-implementation survey for the junior doctors. I know education delivery is a strength of many of your organizations, and you might already have an interdisciplinary education map outlining how all frontline clinicians and support staff receive orientation, education, and communication. I'd encourage you to reflect on your approach to basic life support training and consider if that strategy is an appropriate model for you to emulate for education on planetary health using our existing resources. Again, consider adopting the new medical standards as the baseline education that all staff should receive as we work toward thinking about the building blocks in the learning continuum down the track. And before you jump into it, I encourage you to reflect on some of our lessons learned from early adopters. Despite enthusiastic medical education leads circulating the resources to frontline registrar and consultant educators at the Royal Melbourne Hospital, they didn't actually integrate them into their term 1 weekly intern presentations. When we followed up, it turned out that many of the scheduled presentations early in the year weren't actually clinically focused. So it's important to do your research and know what the curriculum schedule is all about. The most helpful approach was an education lead, essentially spoon feeding the presenters with exact key point slides and the resources they need to update their existing presentation, as well as co-facilitating the session with a peer junior Dr. Green champion, and then following up with presenters before and after for feedback. Our sites that are participating in the quality improvement pre and post integration data collection are updating their surveys to get feedback about these resources, not only from junior doctors, but also senior clinician educators. Of course, this has led us to consider how confident are our clinical educators with this teaching material and the importance of leadership when it comes to this type of change management. My recent engagement with interprofessional education leads at the University of Melbourne has us looking at the resources with a new lens. Are they actually as generalizable as we thought? Or are they too hospital or medical centric? The Royal Children's Hospital team has prompted a resource review meeting next week to assess inclusivity of pediatric considerations. My background training in medical administration, leadership, and change management has me reflecting on data from both the King's Fund in the UK and literature from Canada and Australia, showing that improved engagement with our clinical staff leads to greater productivity at work and ultimately better patient and staff outcomes. That's why we need to focus not just on didactic planetary health education, but also getting our clinicians prepared to lead grassroots sustainability and change projects, exactly like Ashley and Alex presented today, and those leading the Sustainable Quality Improvement Workshop in the forum tomorrow. 12 months after their release, I'm excited to initiate a review and upgrade our resources to benefit patients of all of our professional disciplines. And I extend the invitation for you to join us, as my volunteer team has limited capacity and would love your perspective and expertise. I've touched on a few opportunities in the past 10 minutes. So just to recap, in an effort to promote and embed planetary health principles in your interdisciplinary education program, consider adopting the 4 new medical standards as baseline education standards for all staff. Map your basic planetary health education strategy according to existing approaches to the likes of BLS training. Instead of looking for a new space in the curriculum schedule, remember it's best to take a bite-sized integrated approach with existing education material throughout the year, and advocate for the standards changes within your professional body. I would love to work with you or your organization to update and pilot new and existing resources and work together to ensure that the transition to Australia's health and education sector is sustainable, safe, and healthy for all. Thank you.